Welcome, everyone. Thank you for joining us today. So today we'll be talking a little bit about the early signs of developmental delays and autism. Feel free, as we go through the presentation, feel free to put any questions you have in the chat, or and then we'll have some time for questions and answers at the end as well. Just to give you an overview of what we'll be talking about today, we'll first talk about why tracking child development is important, talk about some of those early signs of developmental delays, the early signs for autism, and then we'll talk about some resources that are available, and we'll also share some resources with you all, as well as have time for questions and answers. And before we get started, we have I'm going to launch a poll. It should be a window that pops up, and it just has a few questions that gives us a better idea of who is joining us today. So it's just 4 questions. Okay. And as you're completing the poll, I'll wanted to share a little bit about who we are. So I'm Dr. Sandra Venegas. I'm a developmental psychologist or a child psychologist, and I'm an assistant professor at Texas State University in the School of Social Work. And joining me today are 2 graduate research assistants who are also graduates in the School of Social Work at Texas State, Laura Hopp and Jennifer Davila Valdez, who have helped with this presentation and who will be assisting in sharing some information today. So we'll just go ahead and get started. You might be wondering, why is it important to track child development, right? We know that children grow and develop, and generally everything's on track, right? But it's important to track child development because it helps us see and make sure that children are actually meeting their milestones or meeting their making developmental gains in the way that we would expect. So it helps us see how the child grows and changes over time. And that helps us know whether or not there's a problem, and see whether or not a child has any developmental delays, or if there's some other concerns that we need to address. And if we do identify that there is a problem, then knowing where those areas are, it helps us know how to better support the child and also support the family. So what are those areas of child development that we need to be looking at? So these are some general areas of development that we can track. So first, we have social emotional development. So this is how the child interacts and engages with others in their environment, and how they also come to understand emotions and experience emotions. Then we have language and communication. So how the child expresses themselves and lets others know about their needs and wants. And this can include things like spoken language, as well as using gestures and facial expressions. Then we have cognitive area, or cognitive development. And this is how a child thinks, reasons, solves problems. And then finally, we have motor or physical development. So these are all those things that require all the big and the small muscles, right? So thinking about your child crawling, walking, jumping, running, as well as using their hands to write and draw, among other things. So these are the main areas of child development that we track, and we know that there are specific things or specific milestones that we can look at within each of these areas. So now we'll talk about some of those early signs of developmental delay, right? So what we'll do in this section is we'll go at different ages and highlight some of those signs of developmental delays, or some of the things that a child should be demonstrating at those specific ages across the different areas of development that we just talked about. So first we begin at 12 months. So at 12 months, a main concern would be if a child has lost any skills that they previously had. So maybe the child was moving around more, but then they stopped moving around as much. So that's definitely a cause for concern if you're seeing a child is losing any skills. In terms of communication and language, by 12 months or 1 year of age, we do expect children to start using simple gestures to communicate with others. So this can include things like waving by or shaking their head, indicating no. At this age, we also see that young children are starting to point to things. So here in this picture, we see this young child pointing to a toy, and you can see it's a very clear point with one finger and not using the whole hand to like reach or to point to something. At 12 months, we should also start seeing a child start to crawl. So if they're not crawling by 12 months, then there may be a concern for their physical developmental development. At 18 months, we start seeing more changes, right? We start expecting the child to start doing more things and engaging with their environment more. So at this age, if you realize or you begin to notice that your child doesn't notice when you're gone or when you leave the room, or doesn't recognize when you return, then it may mean that they're not aware of their environment, and that is a concern at this age. At 18 months, we also see a big surge in language development. So by this age, we typically see children having at least 6 words, and these would be single words. So listed here are some of the most common words that children have by 18 months of age, such as mommy, daddy, ball, bye, dog, no, shoe, baby, book, and hi. At this age, they're building on those points that we saw at 12 months, right? And now they're pointing to show things to other people. So in this image here, we see that this boy is showing something in the distance to his baby sister. And then at 18 months of age, we typically start seeing children starting to walk. So that is building on their physical development. Now, at 2 months, or 2 years, or 24 months of age, we start seeing more changes. So at this age, children typically start to copy actions or words from others. So if you have a game, such as patty cake, your child at this age might copy your actions. They're starting to put more words together, so they will start using 2-word phrases such as more milk, want juice, go outside, and they will typically start be able to follow simple instructions that require basically one step. So put on your shirt, take off your shoes. And at this age, they've, in terms of their physical development, they become a little bit more stable when they're walking. So they typically don't have trouble walking. At 2 years of age. But if they still have trouble at 2 years, it may mean that there's some physical or motor delays. Now, at 3 years of age, we'll start seeing some more evolution of their development and across different areas. So in terms of social emotional development, children are typically making eye contact, especially when they're engaged in an activity. They're also using sentences. So if a child isn't able to put together a series of words to make a sentence, then it may be a cause for concern. Their play also evolves, so it starts using more abstract concepts such as pretend play or make-believe. So in this example here, we see a little girl who is pretending to provide healthcare to her stuffed bear. And then in terms of physical and motor development, we start seeing children have better stability in terms of going up and down stairs. So if they're having trouble with that, or if they're falling down a lot, it may mean that they have some some difficulties or some delays in motor development. Now, at 4 years of age, we start seeing that children socialize a little bit more with their peers, with other children of similar ages. So if a child is ignoring other children or doesn't respond to other children, or is kind of like in their own sort of space, there may be some concerns in terms of their social emotional development. In terms of language, at this age, they should start using me and you, those words correctly. So if they're mixing them up, that may be a cause for concern. And then at this age, they're able to retain much more information when given instructions. So they should be able to follow 3-step instructions. So take off your shoes, go to the bathroom, and wash your hands. So these require 3 separate actions together. And then in terms of physical or motor development, at this age, children should be able to jump in place. And if they're not able to do that, or if they still have some trouble with stability, it may be a cause for concern. And then finally, at 5 years, at this age, we start seeing children having a broader range of emotions that they're showing. So you can very clearly tell when they're feeling happy, sad, mad, surprised, and they have, it's pretty clear that they, are able to express those emotions. At this age, they should also recognize and be able to express their first and last name. So for example, Joe Smith, Jane Smith. And then at this age, we also start seeing when children may be having some attention difficulties. So if they are easily distracted, or they have trouble focusing for more than 5 minutes on one activity, then that may be a cause for concern that there are some developmental delays occurring. And at this age, we're also starting to see much more fine motor development. So thinking about how a child is using their hands. So at this age, they should be drawing pictures. And so if they're not drawing pictures at this age, even if they're not straight lines, they don't have to be straight lines at this age. But if they're not drawing or having difficulties drawing, then it may be cause for concern in terms of their motor development. So those are just a few early signs of developmental delays between 1 year and 5 years of age. And hopefully that will be helpful in terms of thinking about what your child's development should be following in those early years. And we'll share more resources about other developmental milestones at these ages and other signs of developmental delays. So we'll move on to our next section, which focuses on the early signs of autism. And I'll hand it over to Laura Hopp, who will be sharing information for this section.
Hi, everyone. So first, I'm going to talk a little bit about the diagnostic criteria for autism spectrum disorder. A child must be diagnosed by a neurologist or a developmental pediatrician, an expert in the field, and they have to have 2 different kind of delays. One is in social communication impairments, and one is with restricted interest and repetitive behaviors. In the social communication realm, they have to have all 3 of social emotional reciprocity delays, nonverbal communication interaction delays, and relationship impairments. And then on the restricted interest side, they have to meet 3 of the 4 criteria. So stereotyped motor patterns, insistence on sameness, restricted interest, and sensory input difficulties. So 3 of those 4 criteria. And then could you move forward, Dr. Venegas? Thank you. Awesome. And then I'll talk a little bit more about some of the early signs of autism. They're not necessarily related to the developmental milestones that Dr. Venegas is going over, though some are kind of connected, but they can occur in any developmental phase. So these are the social communication and interaction impairments, repetitive behaviors, restricted interests, and sensory concerns, like I mentioned earlier. And I'll go into detail on all of those a little bit further. Isolated, many of these signs of autism might not be a cause for concern for parents and caregivers, but kind of many of these signs put together might warrant like future exploration from families and other support systems. And if anyone is interested, all the information on the next several slides were taken from the ASD Navigator website, Autism Spectrum Disorder Navigator. So the first early sign of autism is related to social communication. And this is the way that people use verbal and nonverbal communication to interact with and understand others. A child who might be showing signs of autism may display limited use of gestures, which might include like not wanting to show parents objects for attention. So like, come over here, I have something to show you. And it, like Dr. Venegas mentioned, not pointing could be a big sign of limited use of gestures. And this might also include facial expressions, so limited use of those as well. Another sign might be infrequent babbling, so not making lots of sounds, or loss of sounds and words if they were previously acquired. So for older kiddos, that might be like regression of language that caregivers might notice. Another social communication issue might be with like not imitating others. So if a caregiver says like, hey, copy this, and the child is not like able to do that or showing that interest in doing the imitation, that could be one, but that may also manifest as like not using pretend or imaginative play. And I wanted to show this video of Evan, who's 17 months old, to illustrate that inability to engage in imaginary play.
That one doesn't have anything that pops. Let's go. It's for you, Evan. It's for you. Look. Hello? Oh, you want to talk to Evan? Here you go.
So this video illustrates some of the social communication difficulties that Evan has. When his therapist like does an action with the phone, he's not able to like imitate her or kind of use the phone to like answer hello or do pretend play with that. He's not making many sounds. He doesn't make any sounds throughout the video, and he's not using his body to gesture or point. So those might be some signs of early signs of autism. So another early sign of autism is related to social interaction, and this is the way that people do back and forth communication. So it's a process of responding to communication cues from others via talking, smiling, sharing, and looking. So this is how you communicate to another person in dialogue that you're engaged and paying attention. So children with deficits in social interaction might avoid eye contact or not display a lot of eye contact with caregivers or with others. So either they're not looking, or they're even trying to like avoid and turn away from that eye contact and looking at another's face. And as mentioned before, this could also include limited use of facial expressions, so smiling, but that also could just be like emoting and showing like different types of emotions with the face. Another one that I've heard really frequently from parents as a concern with autism or with even delays with like auditory processing could be not turning when someone calls their name. So if a parent like calls the child's name, like not looking at them, not turning, and the parent might even have to get like really close to their face to like get that interaction from their child. And then another early sign of autism is related to joint attention, which is the shared enjoyment of an activity. So children typically want to get their caregivers and other people involved in what they're doing, so that they can like have fun in that play together. But a child with autism might display little interest in engaging in joint attention and getting someone involved in that same activity. And joint attention, an example would be like passing a ball back and forth. So it's really common with that like taking turn type of play. And this video of Nathan and Ben shows an example of joint attention.
Push. 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 Uh-oh. Yeah, it fell off. That's right. Here it is. Uh-oh. Go. Push. Good boy. Ready, set, go. You can push. No, stay up here. Stay up here. Go. Stop. No. Nathan. Go. Look, here it is. Use the train. Stay up here, please. Push. Good boy. Ready, set, push. Go. Push. You can push. Yeah, stay up here. Stay up here. Yeah, it fell.
So you guys can see the contrast between the twin brothers, with Ben really actively engaging with his mom. He's making eye contact, he's smiling, and he's doing that back and forth play with joint attention. While Nathan is tending to kind of turn away from his mom, not making as much eye contact or using those facial expressions to show that social interaction piece. The next early sign of autism is related to repetitive behaviors. Repetitive behaviors are an insistence on sameness via routines, or repetitive behaviors like vocalizations and movements. So this might happen when a child is insisting on having things be the same way in their routines and their actions, and it can manifest as repetitive behaviors, or it can manifest as repetitive behaviors. So it might not have both of those pieces. One of the signs could be a child having a really kind of repetitive way of moving their hands, fingers, or body, which we'll discuss further in a bit with some of the sensory issues. They might display like a ritual of lining up objects, so putting things kind of in order or making patterns with their toys to kind of achieve that like sameness and uniform quality with their play. They might also engage in frequently repeating a certain sound, phrase, or activity. And an example of this is called echolalia, which is the repetition of someone else's sounds or words without it necessarily having meaning. So repetitive behaviors are just like a child engaging in something the same way and insisting on that sameness. And this video shows an example of echolalia with Lucas.
Hi, Lucas.
Hello, Lucas.
Say no, say hi, Georgia.
Hi, Lola.
Give me a hug. Come here. Come here. I gotta tell you something. Hi. Give me a big hug. Oh. How are you?
Hello.
Say, I'm fine.
I'm fine.
Good. Good. Are you playing?
I'm fine.
Cheek, 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 cheek. Oh, it's cold. Look.
So Lucas does have some really great skills with eye contact and with engaging with his therapist via language, but the language is that echolalia. So he's just repeating what she's saying to him without it necessarily having like a purpose or being used for purposeful communication. A next sign of autism is with restricted interests, which are strong or intense interest in specific topics, objects, or activities. So children who might show restricted interests are very attached to certain things. It can be toys, topics, doing something the same way. Frequently, I've heard of like letters or numbers being one of the restricted interests there. And this interest interferes with their ability to interact with others via play. So they're more interested in kind of engaging in that interest than kind of playing with the caregiver or achieving different developmental milestones through that play. And this restricted interest might lead to difficulty with transitions and routine changes due to that insistence on having things be the same and wanting to really engage in that interest more than other things. And Dr. Venegas, if you could fast forward to like 55 seconds, this video shows Joseph's reaction when his mom says that it's time to leave and turns off the TV.
1/4, yeah. Okay, bye.
Soccer cheese! Soccer cheese! Soccer cheese! Soccer cheese! Soccer cheese! Soccer cheese!
Joseph?
Yeah, soccer cheese! Soccer cheese!
Okay. Leave him alone. I'll take care of him.
What? Soccer cheese? You watch? Don't turn me on, you watch? PBS Kids?
You know what?
You watch? Turn me on the TV!
When you
Turn
come
on the TV! Soccer cheese! Soccer cheese! Soccer cheese!
Here's some tissue for your nose.
Soccer cheese!
Let me.
I watch some of the Soccer Chase.
I love Cyber Chase too. Who wants Cyber Chase?
Soccer Chase, Soccer Chase.
All right. Okay, Joseph, look at mom.
Soccer Chase, Swapper, it's Soccer Chase.
What did I say about screaming?
Soccer Chase.
What did I say about screaming?
Soccer Chase.
So this video shows kind of how a restricted interest might lead to like sensory overwhelm and a meltdown. So Joseph is so interested in his favorite TV show, Cyber Chase, and when it has to be interrupted because he has to go to school or leave the house, he's unable to transition to a new activity. And I mentioned, I wanted to go to the very end of that video because it shows him having a meltdown kind of with his body, which I'm going to explore a little bit more in the next slide. So another early sign of autism is related to sensory concerns. Sensory refers to the way that external information is processed through our senses. So sight, sound, touch, taste, and smell. And children with autism might have a more difficult time processing some of these senses and can become overwhelmed, which can lead to a meltdown in some instances. So the video of Joseph showed him having a meltdown, which occurred because he was unable to kind of contain his feelings of overwhelm, and this led to extreme reactions. And meltdowns are very different from tantrums, even though they look somewhat similar, because children don't have meltdowns to get attention or to get the thing that they want. And they often continue with the meltdown even after the parent has kind of given in or given them the thing that they want. Whereas with tantrums, children frequently do that for attention to get the thing that they want. And then when they receive that thing, the tantrum stops and they feel better. So some children with autism might have sensory issues, which are more sensory seeking. So these type of children are really looking for more sensory input. They might like to jump a lot, roughhouse, climb. So they really want lots of sensory input in their bodies. Whereas other children might be more sensory avoidant. So they're kind of avoiding unpleasant stimuli by doing things like covering their ears if they hear a sound that they don't like, closing their eyes if they're overwhelmed by like bright light or too much kind of sensory information. Or it can be a combo of characteristics, like a child really seeking like lots of touch, but avoiding like certain textures. And I also want to point out that sensory issues are not, you know, just with autism. Children can have sensory issues and not have autism, or they can have autism and those sensory issues. Other common examples of sensory processing issues might be over or under reacting to pain. So like if a child gets hurt and then just gets up and keeps going, like they don't even notice that something happened to their bodies. Sounds might be an issue. So I've heard before, like really common sounds like a vacuum cleaner or a blender, like causing a lot of distress for children. So something that they're hearing really commonly that they're just like not able to process and feels really overwhelming. Textures are also really common. So like clothes, tags in clothing, different types of food in the mouth, different textures on the hands, like Play-Doh and sand. Some children really like those things, and some children like cannot stand the feel of those on their bodies. And then touch in general is another one. Some children really like that deep touch and pressure, whereas others feel really sensitive to even like really light touches on their body. Another one, as I mentioned, is like light, like really seeking out bright light, or feeling really sensitive to light in the environment. And a last one is food and taste, especially trying new foods, textures. That can be a really common issue for families with children who are showing signs of autism. Lastly, I wanted to go into something called stimming, which you guys might have heard of, which is a way for people with sensory issues to respond to feeling overwhelmed and kind of self-soothe. So stimming might look like children walking on their toes, flapping their hands, or spinning, but there are many different ways that children and adults might engage in stimming as a way to kind of help them feel more calm when things in their environment feel overwhelming and maybe out of their control. And Dr. Venegas, if you could stop the video around like 35 seconds, that would be great.
To stop it or start it?
Stop it.
Okay.
Perfect. So Luca is engaging in stimming when he is doing the spinning, and he's doing a little bit of jumping and also kind of tensing his hands. So there are these repetitive sensory movements that he's doing, in this case, because he's excited. So stimming isn't necessarily something that occurs because a child doesn't like something in the environment, or it feels like overwhelming in a negative way. It could also feel like really exciting and overwhelming in a positive way. So this is a way for him to regulate those positive emotions via movements of his body.
All right, so that wraps up our overview of some of those early signs of autism. And as you can tell, there are some things that are similar to early signs of developmental delays, as well as some early signs in autism. Next we'll go into, why is early intervention or identifying some of these early signs important, right? So we know based on a lot of research that the child's brain is more open to change early in life. So that means that their brains are still making all those connections. So the more experience they're getting in those early years, the better. And we know that with early intervention and supports, we can really change the child's developmental trajectory, right? So if you're thinking, if a child has developmental delays, that means they're falling behind in the things that they should be learning and using, and skills that they should be using, right? And then if we're not intervening, that means that they're just falling further and further behind. So with early intervention, we can kind of help the child catch up and decrease the amount of delays. And we know that intervention is also more effective and less costly if it's provided earlier than later in the child's life. So if we intervene early, studies have shown that children, who, can make progress and can, may require less services and supports later on in their lives. So what should you do if you do have concerns, or if, what can families do if they have concerns about their child's development, either because there might be developmental delays or there's a suspicion that there might be autism. So there's some different things you can do depending on your child's age. If your child is less than 3 years old, then you should contact your local early intervention office. And we included the link here, which allows you to search for your specific state in terms of who that contact information what that contact information is. And then they'll do an assessment and they'll evaluate to identify, what are your child's needs, and provide you, if you qualify for services, provide you with services for your child and for your family. If your child is 3 years or older, then you would need to contact your local public schools and let them know that you have some developmental concerns. They will initiate an evaluation to determine if your child is eligible, and if eligible, they'll provide services through the local school district. It may not be your closest school, depending on what services are available in the different schools. And then for children of all ages, making sure that when you go to your next well-child visit, or your doctor's or your child's doctor appointment, to let your doctor or the nurse know about your concerns, and then they can follow up with more more questions to figure out, are there some developmental delays, and if so, what might be causing or what might be contributing to those delays, and what are some good resources in your local community. So now we can go into specific resources some are more national and available for all families. If you're interested in finding out more about health and human services that are local to you, you can actually call 211. It's an information hotline, and they should be able to connect you with some of the services we talked about, as well as any other social assistance programs available. There's also the Center for Parent Information and Resources. There's these centers in almost, I believe, in every state. And they also have a bunch of information online on different things about child development, different types of services, and different types of conditions that can be helpful. Family Voices is another great organization. They also provide a lot of resources and supports for families. A lot of the information that we presented today came from the Centers for Disease Control and Prevention, Learn the Signs, Act Early, which is an initiative to really identify some of those early signs of developmental delays and make sure that families are able to take action and get supports that they need. And they have a lot of great resources available in English and Spanish, as well as other languages. And they also have a lot of great tools available for families. And I believe they also have some tips on, how do you initiate those services? So how do you communicate with your doctor about your concerns? How do you reach out to your local public schools about your concerns? There's also the Act Early Texas, which is a resource specific for Texan families, but they have a lot of great resources as well related to child development. And then the Autism Navigator, Baby Navigator, they have an online course for parents that is free for, I believe it's based on toddlers. And they have a lot of great videos to kind of showcase what autism looks like, not only in early childhood, but what it might look like over time. So if you want to learn more about autism and how to support your child who may have an autism diagnosis, that's also a great resource. And then related to the CDC, or the Centers for Disease Control, they've created a mobile app that's freely available on both Apple and Android phones. And that way you can actually start tracking your child's development on your phone. It'll ask you for some information about your child, such as their date of birth. And then you are able to start checking off some of those things that your child is already doing, and maybe see some of the things your child may not be doing quite yet. But they also have a lot of great tips and activities that you can do at home with your child to help support their development. And the app is also available, and I believe in other languages as well. So now we'll open it up for questions, concerns, or if anybody would like to ask us anything about related to the topics we've shared so far. And we'll be putting some resources in the chat. So the Milestone Moments book actually goes through a lot more of the developmental milestones, as well as some of those early signs of developmental delays. And it has some tips on what you can do at home with your child. There is a brochure that helps you come up with like a script or what you can share with your doctor if you have concerns, and kind of how to address that conversation. And then we also have a checklist of 16 early signs, and that kind of helps you get an idea of some of those other developmental milestones your child has is meeting or is not meeting. So we have a question. So what tips do you have for picky eaters for children with autism? Yeah, that one, it kind of depends on what type of, what makes them a picky eater. Because I think, as Laura mentioned, there may be some sensory issues. So, I think one of the first things is to try to observe, like, are there certain types of food that they are eating or they're more likely to eat? So we know that for a lot of children with autism, they like consistency, right? So if there's something off in the taste or the texture of their food, that may be not something that they wouldn't want to eat. So I think that would be one of the first steps, is trying to figure out, what is driving some of that picky eating, right? Is it a sensory thing? Is it a taste thing? Or and then kind of, slowly, once you figure that out, then it's kind of slowly trying to work around that, but try to slowly introduce other things so that they're able to kind of expand their food choices. I don't know if Laura, if you have any other thoughts from your experience.
Yeah, this doesn't directly address your question, Lydia, so sorry about that. And this is also not always accessible to everyone, but I do know that not only nutritionists, but also speech therapists and occupational therapists can work with picky eating. And that is available on a sliding scale through early intervention services if a child is ages 0 to 3. And those services, OT, occupational and speech therapy, are available in the classroom for lots of children who have autism as well, if that is helpful for some people.
Any other questions?
Hi.
Hi.
We're supposed to write in the group chat for questions, if you can unmute them now.
You can go ahead and ask.
Okay. So I have 2 boys, and they are 2 years and 3 months old right now. Completely different personalities. So Laura, you were mentioning for they can have 2 different symptoms, like not symptoms, but reactions to tantrums. They can either what was it? Spinning and covering the ears and overreacted to pain, or not reacting to pain type of stuff. Is there one thing for each? Like, if he's overreacted to pain, would he also be spinning? Because one of my boys, he spins a lot, and he spins around toys, he spins around people, and sometimes he's overreacted to pain. He'll just, step on a leg going, it's the end of the world. He starts screaming and throwing himself on the floor whenever he has a tantrum. A lot of times he hits himself in the face, hits his head on the floor and strikes himself, stuff like that. It's hard to redirect him when he's in that state of mind. My other one, he doesn't really have a problem with stuff like that. And you were mentioning echolalia. So I'm not sure if this qualifies for echolalia, but he does repeat words. If I go up to him and I say, "Oh, do we want juice?" He say, "Do we want juice?" He'll repeat it. But sometimes he does, and sometimes he just say juice. Or I don't really know if that I don't really know if that qualifies to talk to their pediatrician about, or if it's, if I should be worried about it. Or I have an oldest, he's 10 years old. He has ADHD, dyslexia, and he's possibly on the spectrum as well. I'm not sure if that means that my friends might be as well. I heard that it's a big spectrum. I don't really know too much about it. But yeah, what is your thoughts on that?
So I didn't I don't think I caught everything you said, but I did catch the part about the echolalia. I think the sound was a little off, but so is the echolalia in the child who already has a diagnosis, or you're concerned about the child?
I'm sorry,
I had myself on the speaker. Sorry, because you and her volume was really low, so I put the speaker on. Can you hear me fine now?
Oh yeah, it's a lot more clear now. Yeah.
So yes, it's not. He doesn't repeat word for word, but depending on if I say, "Do you want juice?" he'll say juice, or "Do you want to go outside?" he'll say outside. Their speech is delayed. They actually both are in speech therapy right now. He doesn't talk, but he doesn't say words unless it's initiated, unless I tell him, "Do you want a cookie?" And he'll say cookie, and I have to say yes, and he'll say yes, and stuff like that.
Okay. Yeah.
So I'm not sure if that qualifies for, maybe he might have autism, but that's not the only thing. The other thing was that he spins around people. He walks around in circles around people. He walks around in circles around toys. His tantrums are a little out of this world. Like he bites, hits himself, throws his head on the floor, just full-blown tantrums. But Laura was mentioning that it's different. I can't tell tantrums apart from whether it's a sensory overload or if he actually is having a tantrum. My oldest, he has stimming. He goes inward and stuff with his hands. And the twin that I'm mentioning, he doesn't do stimming. He doesn't like shake his hands or anything like that. But there was one of the boys that you showed a video that he was messing with the dishwasher and he flapped his hands and he just didn't know where to go. He does literally that. That's what he does.
Yeah, I mean, so it's definitely something I think that merits like bringing it up to your doctor to kind of, because there's a lot of different things that are going on, right?
Yeah.
And then, and how old are they? What is their age?
Oh, I'm sorry. They're 2 years and 3 months.
Okay. So it's definitely, I think, an area or like an age where, we would want to start addressing, some of those things, because especially with like the language, I think, because we see that a lot with children with autism where the spontaneous language or like this language that they start or they initiate is limited. So there's definitely room, I think, for them to start addressing that, especially if they already have speech therapy.
So we started speech therapy almost a year ago, and in the beginning of the video chat, I remember you mentioning that if they lose any of those skills, then it's a cause for concern. And he stopped talking. We started speech therapy. He just blew up, talking. All of a sudden, he wouldn't talk. He wouldn't say outside. He wouldn't say please. He wouldn't say eat or anything. And it's just, I have to get it out of him. A lot of times he doesn't make eye contact. I have to get in his face to get his attention.
Yeah. So I think there's definitely a lot of areas I think that he, would merit an evaluation for autism to make, because I think there's, as you noted, there are concerns, right? And it isn't just language concerns, but, other sensory as well as behavioral things. So it's definitely something to bring up in terms of, like, for example, with speech therapy, I would definitely talk to the therapist to see what they're doing, have them like help you understand kind of how you can also incorporate some things in your interactions with him so that there's more consistency in terms of how people are responding to him or what expectations are given to him. So oftentimes it has to be where they need motivation to be able to initiate that speech, right? And it can be slow. So it doesn't have to be, a whole word, but just even with sounds to request to make that initiation can be a good, starting point. But there's that. I think would recommend bringing up your concerns with your child's pediatrician, or so it seems like you're already connected with early intervention. So just making sure you kind of are prepared for that transition out of early intervention, right? So, and I think that process typically begins like maybe 6 months or so before they turn 3. So it's definitely something to bring up so that they can help guide you and orient you towards the next level of services after early intervention.
Okay. What is the age limit to get diagnosed for autism?
There isn't an age limit.
Oh, I didn't know that. Okay.
Yeah. So definitely, if you at any point when you have concerns, I think it's important to bring them up to your healthcare provider, your child's healthcare provider. So.
Okay. All right. Thank you so much.
I'd also just briefly like to say, Amanda, it seems like you're doing such a great job. I commend you on like how observative you are of your children and like getting them in speech therapy.
Don't mind me. Really... I'm listening to you. I'm just putting the speaker up to my phone.
You're fine. Yeah, it seems like you're really paying attention to these things and like remembering them. So that's really wonderful. You could always like ask the speech therapist or the case manager, anyone else that's in ECI for notes to bring to the doctor's visit just as extra documentation. And then if you are in ECI, occupational therapy might also be helpful, and maybe someone has spoken to you about that, but those therapists really help with the sensory issues. So like the stimming, the sensory overload, and you mentioned self-harm, which is actually like pretty common in children with that intense overwhelm. So that could be helpful. And then, and if that's not available, OT is also accessible through Medicaid or private insurance with a lot of different companies. So those are a couple of other thoughts that I had.
Yeah. Other questions? As we, so we do have a few final things. You can feel free to continue asking questions. But we had a question already about where to get more information. So we do plan to offer more webinars. We're always open to even hearing about suggestions for topics. So if you have anything specific that you would like to learn more about, please let us know. And you can follow us on social media where we do post. We have daily posts on different tips and different key information about disability services and different developmental conditions. And then we have included my email address as well if you have any specific questions. We do have a website for our Aspen program, which is a parent training program that we have. It's a research study, and we are helping support families. We provide training to families and provide coaching. And it's currently only available to families in Texas. But you're also welcome to participate in our social media, or at least follow us there to learn about some other tips and strategies that we'll share. And then before you leave, we're still here to answer questions, but before you leave, please, we'll put out an evaluation. And this just lets us know what you thought about the webinar today, and it helps us get data on continuing this series of workshops. So I'll go ahead and launch a poll, and please answer the poll before you leave. And as I mentioned, we're still here to answer questions or address any concerns you have.